Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula County Health Department's COVID-19 response. Today's Friday, April 2nd, and this is our COVID briefing. We've had 8,744 cumulative COVID-19 cases in Missoula County, with 20 new cases since yesterday. We've had 89 deaths associated with COVID-19 to date. We currently have 119 active COVID-19 cases, with 8 Missoula County residents hospitalized and 8 out-of-county residents hospitalized in Missoula County. And our average incidence per 100,000 is now down to 13. The state of Montana is reporting 104,853 cumulative COVID cases, which is up 133 new cases since yesterday. There are now 969 active cases with 47 hospitalizations across the state, and there have been 1,454 deaths related to COVID-19 statewide. The University of Montana has had 693 cumulative associated cases since the beginning of fall semester back in August, with no new cases reported since yesterday, and there are currently 2 active associated cases. To date, there have been 60,183 doses of COVID vaccine administered in Missoula County, with 21,689 people having received both the first and second doses of vaccine. Today, I'm going to answer some vaccine questions that have come up. I'm going to talk about the loosening of restrictions and share some more information about variants. First, I just want to touch on how and where to sign up for vaccination appointments. Excuse me. All public clinics in the county post their appointment information to covid19.missoula.co. Now that vaccine supply is coming in much more steadily, there are a few vaccination clinics that are running more regularly, like our clinic at Lucky's Market in Southgate Mall. So check that website for the link to sign up for an appointment, or you can call 258-INFO and select option number 3 if you need assistance in signing up for an appointment. You can also sign up for email alerts, which will let you know when appointments will open if you prefer to be notified directly. You can sign up for those email alerts by following the link on that on the covid19.missoula.co as well. So we've been getting a lot of questions about why you should get vaccinated. So here are the biggest reasons that everyone who is eligible should get the vaccine. First, you won't have to quarantine if you come in contact with someone who has COVID if you are fully vaccinated and stay symptom-free. Also, you likely won't get reinfected, hospitalized, or die from COVID if you get vaccinated. The vaccines do work against most variants. And last, we need enough people to take the vaccine so that we can reach herd immunity and finally put this pandemic behind us. Since there are no vaccines approved for children under 16, it is going to be very difficult for us to get enough of our population vaccinated to reach herd immunity, which is why we really need everyone who is eligible to get vaccinated. We've also gotten a few frequently asked questions that I'll answer next. So I've heard that some people don't want to get the vaccine because they think that it was produced too fast and might not be safe. Well, the vaccine came out faster than most vaccines are released. It's not because it was produced too quickly. The trials were performed in the same way as all vaccine trials. This vaccine was just moved to the front of the queue at the FDA so that it would get reviewed as soon as the results of the studies were available. Another question that we get is, how long will it last? This is one that we really don't have the answer to for sure. Studies are still being conducted on how long immunity lasts from the vaccine. What we do know is that immunity lasts for at least 3 months. This is how long study participants were monitored after receiving the vaccine. Immunity could last much longer than that. We just don't yet have the data to be able to tell you exactly how long, but we'll definitely share this information once it becomes available. Can you still get COVID if you've been vaccinated? It's not likely that you'll be susceptible to COVID after being vaccinated. All 3 current vaccines are highly effective at preventing COVID. If you do get COVID after vaccination, you will likely not get as sick, and you're less likely to be hospitalized or die from COVID. Will the COVID vaccine change my DNA? So the answer to that is no. The COVID vaccine stimulates immune response so that your cells that help fight infection will recognize the COVID virus and will protect you from getting sick, but it does not affect your DNA. So next, I want to clarify a couple of misconceptions that we are hearing out there right now. The first misconception is that the vaccine doesn't stop transmission, so why take it? When the vaccines first rolled out, the CDC cautioned that it was unknown whether the vaccines prevented asymptomatic transmission of COVID. This wasn't the main focus of the clinical trials, so it was not tested in that setting. The focus of the clinical trials was to see whether vaccines could prevent serious illness and death. Science is ever evolving, and the latest studies are showing that the vaccines largely do prevent the transmission of COVID. Another one is that the vaccine isn't approved for kids, so doesn't that mean that it's dangerous? And the answer to that is no. The initial clinical trials for the vaccine did not involve children. That's why they weren't approved for use in children. There are several clinical trials underway right now in children. So far, the results have been really promising. A study that came out this week actually shows that the Pfizer vaccine is 100% effective in children that are 12 to 15 years old. Pfizer says that they plan to file for an emergency use authorization in that age group in the coming weeks. Okay, so moving on from vaccine stuff, let's talk about the decision by the Board of Health to move forward with easing some restrictions for events and gatherings. Last week, the Board of Health adopted the alternate Appendix A that would then go into effect when we met certain benchmarks. These benchmarks were actually met much faster than we anticipated, and we met those benchmarks early this week. So the alternate Appendix A for events and gatherings lifts restrictions on the numbers of people that can be included in events and gatherings. Masks will still be required, and organizers will still need to mitigate areas and times of crowding, take steps to ensure participants are aware of COVID-19 symptoms and don't attend the event if they're having symptoms, and sanitation and hand washing stations must be provided. That information is all available on our website at missoulainfo.com. So last, let's talk a little bit about variants. I'm not going to go into a whole lot of detail on this briefing about it, but I do want you to know that the California variant as well as UK variant have been identified in Missoula County. Both of these variants spread easier than the original strain of COVID-19, and both show some resistance to treatments that doctors have been using on COVID-19 patients as well. So with these variants having been identified in our community, it's critical that we continue to wear masks, wash our hands frequently, keep our social circles small, and get vaccinated whenever you first have a chance. So that's it for today. I know that was a little bit longer briefing. Thanks for sticking with it. As always, you can subscribe on YouTube under my name, Cindy Farr. That's CindyFarr. Click that notification bell to get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. Check out our website at missoulainfo.com for all kinds of COVID information, and go to covid19.missoula.co if you would like to schedule a vaccination appointment, and you can call 258-INFO for any questions that you might have. You can select option number 2 if you want to get scheduled for a test, and you can select option number 3 if you want to get scheduled for a vaccination. And until next week, everybody, stay healthy.